everybody, welcome back to today's episode. Hope you're all well, thanks very much. Lovely sunshine today outside, finally a bit of sunny weather. I hope you're all enjoying it. I had a look around the web today just to see if I could find anything interesting to report on. I didn't come across any interesting exercises or treatments. What I did come across is a new product that has been released. It's called PosturePlast, which is by Adam Dallison, who is an osteopath. I had a look around the website. Now, PosturePlast, obviously, as it already suggests, it's very much meant to help people to gain or regain a better posture. Now, we obviously all know it's quite a well-known fact that good posture is definitely very important to try to minimize the chances of developing back pain. Now, obviously, there's always find so many products being released on the market. Not all products are as good as they make out to be, or not not living up to all the hype around it. Now, as I said, I've only just come across this PosturePlast. I had a little look into it to see what it is about, what is it used for. Adam has been practicing 14 years as an osteopath, so obviously he's got some considerable experience, I would say. Now, PosturePlast, yes, I'm sure will provide pain relief. A lot of products, ice packs, heat packs, whatever packs. Lots of these types of products out there. They will provide some pain relief. Just having a look at the story itself. Obviously, Adam felt from using it. It's been helping a lot of his patients. One of the things, and obviously one of the thoughts behind it, it's trying to stop people from moving out of the safe zone, as Adam calls it, which is which is a very important thing, especially when people have acute back pain. It's obviously important when they are moving, but in the initial few days, it's very important to try to minimize placing too much stress on the injured structure or structures of the lower back. The one thing I'm not totally sure about, it states that it treats the main cause of lower back pain, which is bad posture. Now, I would like to disagree on that with Adam. I'm sure he has his valid reasons for that, but yes, posture, as I said, is very important. Having bad posture is definitely going to lead to some form of back problems, if it's lower back, mid back, the neck, or a combination of all three. But as I often have said before, back pain tends to develop in 4 stages, which I would like to come back a little bit later on. But as I said, I wouldn't say bad posture is the main cause. I don't think that's totally true, because having a certain type of posture could be pain posture. People, because over the years they've had episodes of back pain. Because of the episode of back pain, they've developed maybe some weak muscles, tight muscles. In other words, they develop some muscle imbalances. Just saying that that the posture is just the cause of back pain, I think that's a little bit goes me a little bit too far. Now, going to one of the things, why use PosturePlast? An interesting few stats Adam had. Obviously, he talked about that he has treated, or he trialed 90 patients in his clinic that either have been suffering acute or chronic lower back pain, and some of them came through the NHS and some were private patients. Now, he reported that 78% had a reduction in their back pain. So there's a reduction. So obviously they haven't got rid of their back pain, but there's a reduction in pain. Now, medication, lumbar belts, cold patches, heat patches, all those types of things, they obviously will all, at some form, provide some back pain relief. But the thing, obviously, I would imagine that people would like to see, and it's what I, as a practitioner myself, would like to see, is people leaving the clinic at some point, or being able to go about their day-to-day life where their back pain problem is controlled, not just where they relieve their back pain by using something. When they stop using it, the back pain is coming back. That's, to me, not the right answer for their back problem. Now, I'm not saying that PosturePlast is not doing that, because as I have not talked to any people who have been using this themselves. But the theory behind it, I can't really see, as I said, just by using this particular PosturePlast, that it's going to solve your problems just by correcting the posture. 90% of wearers reported PosturePlast prevented poor posture. Now, which I can see, if it does help to keep people in a better posture. Yes, I mean, that's something that would be beneficial. 88% would recommend PosturePlast to somebody who had back pain. Now, obviously, these people come through his own clinic. I would imagine my patient would try to say something positive about me or whatever I've been doing with them as well, as a kind of courtesy. But I would love to see people not just going to Adam's clinic, but people have been buying it themselves, have been recommended by their own practitioner to use it. Would love to hear some people's stories about this. The other one thing I just wanted to have a quick look at is a page where he talks about what's it good for. Now, basically, it looks to me like the way he's been looking at it seems to be basically helping everything, from having better sleeping positions, pain during pregnancy, muscle spasm, strain, tension, stiffness, sprains, tears, slipped disc, herniated disc, torn disc, bulging disc, prolapse discs, spinal joint problems, sciatica. Now, as I said, not all conditions are down to poor posture. Not sure if herniated discs will be solved, or a torn disc or a prolapse disc will be solved by putting a patch on your lower back. I'm quite doubtful about that personally, but that's my humble opinion of 20 years experience in treating low back pain. But as I said, I would love to hear people out there who've been using it themselves. I just would like to, at the end of this, I'd just like to share with you again the 4 stages of back pain development, which is very important to understand, and hopefully gives you a bit of understanding in relation to PosturePlast and how that's maybe going to help your type of back problem. Okay, so I'll leave it like this. As I said, shortly I will go into explaining you the 4 stages of low back pain development. Thank you. Okay, we're back. As I mentioned before, I just wanted to go a little bit more into depth on how back pain really starts in the first place. 98% of back pain tends to be mechanically based. Now, I generally speak about what we call the 4 stages of back pain development. Stage 1 is where, because of postural habits, could be somebody sitting in the office all day, certain sitting habits, could be sitting a lot in the car, or could be even standing kind of postures whereby the spine is just somehow not stressed in the right way, and it's like this happens day in, day out. Could be faulty sporting techniques, the same idea during the training, during competition, is whereby the spine is being stressed incorrectly, or somebody might be, because of their work or whatever it may be, regularly, maybe day to day, places but quite a lot of physical stress on their spine. Because of that, over a period of time, eventually people end up in what we call stage 2, which is you develop a dysfunction of the spine, or also what can happen is that at some point muscle imbalances will start to occur. So in a way, the muscle imbalances also then can cause, again, the dysfunction of the spine. That goes on for a while, and then eventually people end up in what we call stage 3. So because the spine has been dysfunctioning, there have been muscle imbalances, so the spine can't function the way it should function. So excess stresses may be placed on the spinal joints, the facet joints that can start to lock, or the discs become weakened. So discogenic problems could be a herniation of the disc, or other types of problems will occur. And then stage 4 is where you start to get the pain. And so pain from a locking joint, a disc type problem, or any other problem like ligamentous overstress, whereby the ligament, you get maybe some micro trauma to the ligament, scarring building up, and that eventually will start to cause pain. Now, most treatments will concentrate on stage 3 and stage 4, so there may be pain relief like medication, acupuncture, laser therapy. In this case, here we'll be talking about the laser therapy, so which is very much focusing on stage 4. So the mechanical symptoms, unlocking facet joint, and disc problem, or any other problems, are not being treated at all. Nothing is being done at stage 2. The dysfunction or the muscle imbalances are not being worked on. In other words, stage 1, is there any thought being put into that maybe somebody, all the way going back to the beginning, where did the problem start in the first place? So maybe, as I said, somebody may have a faulty sporting technique, etc. So this is really where the treatment should be concentrating on, not just stage 3 and 4, but also stage 1 and 2. So just hope that this maybe explains things a little bit more for you. I hope you enjoyed this particular episode. Please leave a comment, ask me any questions you have, and I hope I will be seeing you in the next episode. Thank you.